The confirmed number of new coronavirus cases reported in Los Angeles County in the last 24 hours is 826, with 8 additional deaths. Here in Torrance, 7 additional cases were reported, with no new deaths. Welcome to COVID-19 Today. I'm Colin Kushner, filling in for Rhiannon Trutanich. It's Tuesday, October 12th. The U.S. Food and Drug Administration's advisory panel will meet this week to debate the Moderna and Johnson & Johnson booster shots. The FDA's Vaccines and Related Biological Products Advisory Committee will meet Thursday and Friday, less than a month after the authorization of Pfizer's booster shots for millions of Americans. The advisory group expects to discuss data on the safety and effectiveness of a Moderna booster shot in adults on Thursday, then on Friday debate the Johnson & Johnson booster shots for adults. The FDA could make a final decision within days of the two meetings, then hand it off to the Centers for Disease Control and Prevention's Vaccine Advisory Committee to make their own decision. The CDC's next vaccine advisory meeting is scheduled for October 20th and 21st, where conversations about the booster shots are expected to take place. Tourists traveling from outside the U.S. are getting the green light to enter the country beginning November, as long as they're vaccinated against COVID-19 with a drug approved by the FDA or the World Health Organization. While the CDC plans to release additional information and guidance for travel requirements, they've informed airlines that vaccines that are FDA authorized or approved or listed for emergency use will meet the criteria for travel to the U.S. The 3 approved vaccines for COVID-19 include Moderna, Pfizer, and Johnson & Johnson, with the WHO also granting approval for AstraZeneca, Sinopharm, and Sinovac vaccines. Lax travel restrictions for vaccinated foreign travelers are expected to take effect by early November. Getting COVID-19 while pregnant may significantly increase the risk of complications for expecting mothers. That's according to 2 new studies released recently. In one study, of the 100 COVID-positive mothers who delivered babies between March and September of last year at one hospital in Texas, 58% of those with symptomatic infections and 46% of those who were asymptomatic delivered their babies in emergency circumstances. That same study, which has not been peer-reviewed yet, also found that mothers with symptoms had babies born breached and were more likely to have decreased fetal movement, have a low level of amniotic fluid, and were more likely to be admitted to the intensive care unit after birth. One expert says problems could be linked to chronic inflammation caused by COVID-19, which could be dangerous for both the mother and the development of the fetus. The second study, which was peer-reviewed and published in the Journal of Maternal, Fetal, and Neonatal Medicine, looked at the impact of the virus on women in their 3rd trimester of their pregnancy. 2,400 women were studied at one hospital in Israel between March and September of 2020, with results showing a significant health difference between expecting mothers who had COVID-19 and those who did not. Pregnant COVID patients had higher rates of gestational diabetes, a lower white cell count, and also experienced higher bleeding during their delivery. Currently, only a third of expecting mothers are fully vaccinated against COVID-19. In September, the CDC urged pregnant women to get the vaccine to protect not only themselves, but their unborn babies. Scientists in Japan are getting closer to developing a more widely applicable vaccine that could offer cross-protection from not only COVID-19, but possible future strains of the virus. In a newly published article in the Journal of Experimental Medicine, Japanese scientists say they are working on developing a vaccine involving genetically engineered proteins from SARS-CoV-2. Researchers at Osaka University in Japan genetically engineered the receptor binding domain of the spike protein, and mice exposed to these engineered proteins produced a greater proportion of antibodies. The study found that the antibodies made were a type that scientists call neutralizing antibodies, where it's shown to neutralize not only the SARS-CoV-2, but also SARS-CoV-1, which caused the SARS outbreak back in 2002. Because of challenges like ensuring that immunity is durable and broad enough to handle emerging diseases, scientists predict that it may still be several years before a universal coronavirus vaccine is developed. Public health officials are giving kids of all ages the green light to celebrate Halloween again with family, friends, and neighbors. Public health officials say many Halloween activities can be held outside, but there are still risks to consider. Here are some tips to help keep everyone safe. Try to keep gatherings small and outdoors. If people need to meet indoors, improve airflow by opening windows and doors. For those wanting to trick or treat, limit groups to immediate households, avoid mixing with many different families, and don't be afraid to ask about people's vaccination status and recent risks before deciding who is safe to trick or treat with. Avoid indoor haunted houses where people may crowd together and scream. These situations can increase the risk of spreading COVID-19 if someone in the crowd is infected. Also, stay away from crowded places in general, wear a mask, and get creative and incorporate a face mask into your costume. And lastly, be flexible and willing to change your plans or leave if you feel uncomfortable at any time or find yourself in a place where the coronavirus can spread more easily. Public health officials urge every qualified individual to get vaccinated for COVID-19 if they haven't already, and get the flu shot as well to stay extra protected. Thousands of Kaiser Permanente workers may go on strike in Southern California demanding better pay. More than 95% of more than 18,000 union members in the state voted in favor of authorizing a strike, which could significantly impact operations for the system's 14 hospitals and more than 200 clinics in Southern California. The United Nurses Association of California Union of Healthcare Professionals, which represents nurses and other healthcare workers, would still need to provide a 10-day notice before they strike. Now, if union leaders decide to strike, as many as 24,000 registered nurses, pharmacists, midwives, physical therapists, and Kaiser healthcare workers could walk off the job. Union negotiations with Kaiser have been ongoing since April of this year, asking for a 4% wage increase for all of its members over the next 3 years, while Kaiser is offering 1% with a 1% bonus, and new hires in 2023 would be offered a reduced wage of nearly 25%. If a strike were to take place, it would impact hospitals across Southern California, as well as a number of clinics and medical office buildings. 1 in 4 Californians receives their health care from Kaiser Permanente. Just as the holiday season approaches, Netflix made a big announcement with Walmart. The streaming service company will expand its effort to sell clothing and toys based on its hit shows such as Squid Game and Stranger Things. Walmart created a dedicated online hub for selling Netflix merchandise. It's the first time Netflix has created a dedicated branded area on another store's website. This is only an online partnership, though, so you cannot find these items at Walmart's brick-and-mortar stores. Walmart officials say this partnership allows them to keep a finger on the pulse of the hottest fashion, music, and toy trends emerging from Netflix's shows. Netflix began selling items through Walmart in 2018. It also has relationships with many other companies, including Amazon, H&M, Sephora, Nike, and Target. Parents may want to check their pantry for this popular baby food product, as it was recently recalled due to levels of inorganic arsenic. The FDA announced the brand Parents' Choice Rice Baby Cereal, sold at Walmart, is now under voluntary recall after routine testing found increased limits of inorganic arsenic, which is considered to be a cancer-causing chemical if exposed to it long term. The baby food product is manufactured by Maple Island Inc. and is distributed nationwide by Walmart. Since the recall, the product has been pulled off its shelves in store as well as online to prevent future sales. So far, there have been no reports of illnesses related to the product. Customers are asked to disregard the product or return it to Walmart for a full refund. If you're looking to forget about COVID for a couple of hours and celebrate the power of theater, El Camino College has a brand new show coming up. Live theater performances return to the campus theater this Friday with Psycho Beach Party. The comedy horror play takes place in Malibu in the 1960s and tells the story of a would-be surfer girl harboring a deep, dark secret. Performances run October 15th, 16th, the 22nd, and 23rd at 8 p.m., and a matinee on Sunday, October 17th at 3 p.m. El Camino requires that all theater patrons complete a health screening questionnaire and temperature check before entering the venue. Masks will be required at all times for audience members, regardless of vaccination status. And socially distanced seating will be assigned by the ticket office as well. You can grab tickets now at centerforthearts.org. The Torrance City Council meets tonight to conduct city business, Among the agenda items include several proclamations that will be read, including October 23rd as Make a Difference Day in Torrance. October will also be proclaimed Cybersecurity Awareness Month, National Arts and Humanities Month, Italian American Heritage Month, Paint the Town Purple Month, and Breast Cancer Awareness Month. Then the city manager will recommend that City Council accept and appropriate a $25,000 donation from SARS Regis Group for the Torrance Temporary Housing Program. The city manager and the finance director will also recommend that City Council approve revisions to the proposed fiscal year 2021 to 2022 of the fiscal years 2021 through 2023's adopted biennial budget and capital improvement plan. There will also be a recommendation to award a consulting services agreement for strategic communication and public education services for a potential sales tax ballot measure. These items and much more will be discussed tonight and can be seen here on our channel, online, and on the city's social media platforms. You can also find the full agenda at torranceca.gov. The meeting begins at 6:30 p.m. Well, before we go, at the end of each program, we like to share feel-good stories from our community, pictures, images, and videos that remind us of how resilient our community is and how Torrance truly cares. The youth sports section of the city's Recreation Services Division received an award for finding innovative ways to keep playing sports safely during COVID-19. Staff members created a co-ed outdoor basketball skills clinic for children in grades K through 8 at Wilson Park back in February. The program was designed to keep participants, staff, and coaches and spectators outside in a safe environment. The clinic was very successful, with each grade filling to capacity, leading the city to offer another clinic in April. The National Alliance for Youth Sports awarded the Excellence in Youth Sports Award on October 1st to the city. Prizes include complimentary registrations to participate in the organization's Youth Sports Congress, a custom award and promotional video featuring the city's efforts, and national, state, and local recognition. Now, if you have a great story, upcoming event, a photo or video you'd like to share, email us at covid19today@torranceca.gov. We'd love to hear from you. Well, that's our update for COVID-19 today. We'll see you back here tomorrow as Christine Lee brings you the latest. Be safe, stay healthy, and thanks for tuning in. We'll see you next time.